My name is Cary Cooper, and I'm professor of organizational psychology and health at Lancaster University. And we've had this alleged incident that Suarez has bitten somebody. We don't know for sure whether he has. It's still sub judice in a sense. But I think it raises another issue, and quite a big issue. And an issue that interests me is that increasing the work environment is more pressure than ever before. There are fewer people, they're doing more work, they're feeling more job insecure, they have lots of pressures to deliver, whether it's in the City of London, on a football pitch in the World Cup, or anywhere. At almost all walks of life, and you get it among teachers, you get it among social workers, you get it among doctors and nurses. It prevails everywhere. So the issue is, how do we help people cope with these excessive pressures when they are not coping with it? And what is it in the work environment, in many work environments, that can help people cope? Because work environments themselves create atmospheres frequently which cause people excessive pressure. So how they're managed, the pressure put on them by their coach, their manager, whatever in life can do this to people. And so for me, this latest thing is an illustration of a problem we have in wider society. Stress is now the leading cause of sickness absence in the UK. It used to be musculoskeletal illnesses, backache, and that kind of thing. But it is now workplace stress. And so how do we make work environments better? How do we help individuals cope better? How do we get the stress and energy that they exude, whether it's on a football pitch or in the city, to work more constructively rather than negative ways? And it is the social scientists who are dealing with this issue. And they're dealing with it because they're trying to identify in the workplace what it is that's causing it, how can we deal with it, doing the science to show what interventions work and which don't, how we train managers in the private, public, third sectors to behave in a way that doesn't damage people and create excessive stress. We have worked in lots of projects which is looking at workplace stress. That is to say, in organizations, whether it's the police or whether it's a local authority or a hospital or a private sector company, we've done almost all of them. And what we do is use psychometric measures to measure what's going on in the organization, and we break the data down by demographics, and we can say that part of the organization has a glass ceiling for women, that has a long working hours culture, that has a bullying manager. And then what we do is interventions and see whether we can, by collecting data before and after, make an impact on that. And see if we can reduce the sickness absence, if we can increase productivity, whatever the outcome measure we can measure, we do, looking at the health of individuals. But that kind of science is going on all the time in the social sciences, by psychologists, by sociologists, by occupational health people, by HR people, human resource managers. It goes on, it's going on all the time now. Social science is trying to improve the health of the work environment, particularly since stress is the leading cause of sickness absence.